All right, so the second part of this unit, we're going to talk about trends in healthcare. And this is all stuff that your book specifies as trends. And I know this stuff is not super exciting, but bear with me. We're going to do a project for our test that's going to be a little bit more exciting, I hope, than what some of this stuff is. So, the first trend we're going to talk about is cost containment. And this is how we try to control the rising cost of healthcare, but still achieve the maximum benefit for every dollar that's spent. Looking at some of the technological advances that we have, things like organ transplants, artificial hearts, and then just advanced technology in general, we're seeing that people live longer, but with that comes some more expensive lifelong care. And then those organ transplants and those artificial hearts, in and of themselves, are not cheap procedures, or then the medication that comes along with maintaining, staying healthy afterwards, or the cost of recovery and rehab. So, just these advances, while it's great, are causing us to have rising costs in healthcare. When we look at some of our aging population, remember we've talked about how the overall average lifespan has now greatly increased from what it used to be. But we do see more use of pharmaceuticals or prescription medication. If you've ever been to a grandparent's house, you've probably seen that they have a very large pill dispenser or bag full of medications, and those all cost money, especially if someone doesn't have insurance or doesn't have great insurance. We see more chronic disease, things like heart disease, diabetes, high blood pressure, high cholesterol, that require those more frequent doctor visits and require that higher cost of care and monitoring. So, there are different ways that we can try to contain costs. The first is diagnostic related groups, or DRGs. These were put in place by Congress as a way to help control the costs for Medicare and Medicaid, both of which we'll talk about in our next unit about healthcare systems. But for now, just know that they're federal programs. So, under these DRGs, our payment's going to be made based on diagnosis. So, no matter what, there's a certain amount paid for each disease or diagnosis. So, if you go to the hospital and you get diagnosed with having a stroke, they're going to pay a certain amount for that stroke diagnosis. Maybe it's $10,000. If the cost of your care was only $8,000, then the hospital keeps that extra $2,000 and they've made money. If the cost of your care was $12,000, then the hospital has to eat that $2,000 and they've technically lost money. So there's ups and downs to this kind of on both sides. We also see well, we talked about hospital acquired infections. So those things that you get in the hospital that's not related to the reason you're there. Because if someone gets an HAI, they have a reduced reimbursement. So the insurance company is not necessarily going to pay out to the hospital to cover the cost of something that they caused. Another method is fee for service compensation. So that's when we're paying for stuff based on the service. It's starting to be replaced with value based compensation. So again, fee for service, we're paying for services. So we don't have a lot of incentive to consider the cost. Whereas value based, which is what we're switching to, is similar to the DRG we just talked about, and it's a bundle payment. So again, a set amount for each disease or diagnosis. So think about, like, if you go to the doctor with stomach pain and they order 15 different tests. Well, each of those 15 tests might cost $500. So if this was fee for service, then they're going to get paid that $500 for each of those 15 tests. Whereas value based, they're only going to get paid that set amount for what you're diagnosed with. Another option is mass or bulk purchasing. If you've ever been to someplace like Costco or BJ's or Sam's Club, you'll see that sometimes it's cheaper to buy things in those larger quantities. Anybody that's ever been to Lowe's or Home Depot, you might notice that there are certain items that have a contractor rate on them, but it says you have to purchase at least 20 or 25. So maybe you save 25 cents per item, but you have to buy that larger quantity to get that smaller price. Another way we can contain or lower costs is outpatient services, so care that you get without being admitted to the hospital. For instance, my husband just had a hip replacement. It was done at an outpatient surgery center in Somerville, so he didn't have to pay for all of the extra costs that come along with getting admitted to the hospital. Other things are x-rays, lab work. These can be done outpatient, so you don't have to also pay the hospital fee. This isn't necessarily a method per se, but early intervention and preventative care. So I know that at your young age, it probably seems silly to go to the doctor every year unless you need a physical for sports, because you probably don't have a lot of health problems. But as you get older, it's helpful because you can start to see if there are any issues popping up, whether it's pre-diabetes or pre-hypertension, which is high blood pressure. Getting these frequent and preventative checks helps provide some of that care before an illness starts. So it's always going to be cheaper to prevent the illness, like take that high blood pressure medicine, is going to be cheaper than paying for the cost of having a stroke and the rehab and everything that comes along with it. Preventing illness is always going to be cheaper than treating it, even if it seems like, well, I don't want to spend this $15 a month on my medicine. It's going to be cheaper in the long run. Other methods are things like patient education, immunizations or vaccines, and regular physical exams. We want to make sure that we keep up with all of those things so that we're not paying more in the end when we develop a disease or illness. Energy conservation. So you've probably had your parents tell you, turn the water off, turn the lights off when you leave the room. Those things add up, especially if you've ever seen or asked your parents about the water or gas bill or the electric bill. So there are some people, they unplug all their appliances to keep that electricity cost down. And then we have to look at some of these bigger hospital buildings. How do we use more energy efficient measures? Whether it's automatic sinks or automatic lights in bathrooms so that lights aren't on constantly 24/7. Looking at recycling, just ways that we can conserve energy and kind of cut down on those costs. All that said, it's super important to remember that quality of healthcare should not ever be lowered just to control costs. So we're not giving somebody poor care or not doing a test or not offering a specific medication to save costs. We talked a lot about the aging population, and we're going to see that home healthcare is going to be one of our more rapidly growing fields. DRGs, like we said, those are going to result in shorter hospital stays, but that doesn't mean that the person's sent home 100% good to go. They might still need rehab or physical therapy or occupational therapy. It can be seen that the care at home is less expensive than care at the hospital. And there's going to be lots of different aspects that we see involved with home health care. You can have nursing, physical or occupational therapy, respiratory care, social services, nutrition and food services, so things like Meals on Wheels, or people that deliver food or help prep food, and then homemaking services. Maybe you need help with your laundry or help just straightening up around the house. There are people that will come in and help with those things and hopefully be cheaper than staying in the hospital or a nursing home. Geriatric care, this we're going to see just rapidly expanding in the coming years. This is care for our elderly. Typically, geriatric is over 65. And with the baby boomers getting older, people just living longer thanks to advances in medicine, we're seeing a pretty significant increase in need for people that are willing to do geriatric care. We're also seeing a need for facilities that can accommodate our geriatric population. So places like adult daycare. Maybe your grandma lives with you, but she shouldn't be left alone during the day. Well, mom and dad still have to work. So where can we send grandma to hang out and get some increased socialization, but not be in any trouble or risk hurting herself? retirement communities, assisted or independent living, and then long-term care. And we'll get into the difference between all of those when we get into systems. Telemedicine, this can be a handful of different things, but this is where we're using video, audio, and computer systems to help provide medical or healthcare services. It can be anything from EMTs transmitting documents to the hospital, like EKGs, and they can do that from the ambulance. It can be psychiatric consults that are done over Zoom or some other video platform for mental health patients in the field, because truthfully, the ER is not the place for them to be. So this helps kind of mainstream their treatment. We'll talk about electronic medical records. There's a huge benefit to this. There's easier access, easier transmission between facilities. Services on telemedicine we see sometimes cheaper. They definitely are more convenient. And also people that are stuck at home, whether it's a chronic illness or disability, or they just don't have access to transportation, can have a doctor's visit still without worrying about covering the cost of transportation or getting there with their disability or their illness. Wellness is one of my favorite topics. We're going to talk about it a lot. But as a definition, we're going to look at it as the state of being in optimum health with a balanced relationship between physical, mental, and social health. This provides us with an increased awareness of our need to maintain health and prevent disease, which as a result provides us with improved quality of life and saves costs because we hopefully have less doctor visits when we're not sick. Wellness, we're going to talk about all the different types, but it can be made up of a variety of things, whether that's exercise, good nutrition, weight control, healthy habits. We're going to go into all of it though when we talk about the different types. So there are 5 different types of wellness. I would make sure that you at least know what defines these different types. Physical wellness is going to be how we maintain our body, our physical physique. This can be a well-balanced diet, regular exercise, making sure that we're getting those routine exams and vaccines, avoiding alcohol, tobacco, says caffeine, obviously in moderation, drugs and risky sexual behavior, which is defined as multiple partners, not using protection. Emotional wellness, how do we feel? Are we able to identify our personal feelings? Are we able to express them appropriately? Being able to accept your personal limits. We all know we have limits. Punching a wall because I'm mad is not expressing my emotions correctly or appropriately. Are we able to adjust to change? How do I cope with stress? Some people cope with stress really well. Some, on the other hand, do not. Social wellness. So how do I act around others? Am I able to show concern and affection and tolerance for other people? How do I communicate with other people? How do I interact with other people? And we all know with COVID, when we've been under quarantine and learning from home, some of us may have lost our social wellness or social interaction capabilities or skills and are now working to build those back up. Our mental and intellectual wellness. Am I creative? Am I logical? Am I open-minded? Am I continuing to learn? Now, even if that just means like I've read a book about something or paid attention to the news, am I solving my problems? Am I helping to solve other people's problems? And then last is spiritual wellness. So this doesn't necessarily mean that you're religious. Spirituality and religion are different. But I'm using my values, ethics, and morals to find a direction and purpose with my life. Now, when we look at what wellness has done to our culture, we see lots of different places popping up, quote unquote, wellness centers. weight control facilities, health food stores, nutrition services, stress reduction counseling, habit cessation management. So if you need help quitting drinking or quitting smoking, there are places that can help you with that. Now, I will say we are not going to focus a lot on diet because food is not good or bad. You can eat whatever you want, whenever you want, as long as you are listening to your body, stopping when you're full, and eating when you're hungry. But I want you to pay attention when you're out and about and just driving around Monk's Corner, Goose Creek, wherever. There's a lot of different places. I live in Foxbank, and there's Foxbank Nutrition. You would think that that means that there's some sort of quote unquote healthy options or people that are experienced in nutrition, which isn't the case. It's a smoothie store that sells an MLM called Herbalife. Yes, they taste good. Are they nutritious and healthy? Probably not. So we have to be aware in our society where we're seeing an increased focus on wellness, what actually is being sold to us, and is it what it appears to be? Now, as a result, with this increased focus on wellness, we've seen an increase in holistic healthcare. Holistic healthcare is where we're seeing promotion of our physical, emotional, social, intellectual, and spiritual well-being. And we do this by treating the whole body, mind, and spirit. Similar to what we talked about a little bit, we'll get into Chinese medicine practices. But here with holistic healthcare, everybody's recognized as a unique person with their own individual needs. We're going to see lots of different methods of diagnosis and treatment. Our treatment's going to be based more towards protection and restoration and focused on our body's natural healing powers. We're letting the patient be responsible for choosing their own care, which they should be anyway, but here we're seeing more of a focus on the patient making that decision. And as a result, you as the healthcare worker always have to respect their choice. You can talk to them about the pros and cons of the different options, but it's still your job to respect their choice and give them that autonomy to make the decision. When we look at healthcare in the United States, I would make sure that you know that it is the biomedical or Western system that we use most commonly. We're basing all of our medicine on evaluating physical signs and symptoms, determining the cause of the disease, and treating the disease. But we are starting to see an increase in what we call CAM therapies, or complementary and alternative therapies. Complementary is when we're using them together in conjunction with conventional medical therapies, and alternative is when we're using them in place of or instead of those biomedical therapies. CAM therapies, similar to the idea of holistic healthcare, we're seeing consideration of the whole individual, recognizing that the health of each part has an effect on the person's total health status. There's a belief that each person has a life force or special type of energy that can be used in the healing process. And a lot of these therapies are going to be based on cultural values and beliefs. So just some examples. I would at least be familiar with what each of these are. Chiropractors, they believe that the brain sends energy to all parts of the body through our nerves from our spinal cord. Acupressure is based on the belief that illness and pain occur when our chi, or life energy, is blocked. Antioxidants encourages the use of certain vitamins to neutralize free radicals. Chinese medical practitioners believe that a life energy flows through every living person and an invisible system of pathways to help link those organs together and connect them to the external environment. And a homeopath believes in the ability of the body to heal itself through actions of the immune system. And like we said, you can use these complementary to other medical practices. So maybe you are seeing a doctor about your back pain and taking medication, but also seeing a chiropractor. That's okay. Biotechnology is another trend that we're seeing. This is the use of genetic and biochemical processes of living systems and organisms that helps develop or modify useful products. We've been seeing biotechnology used for thousands of years in things like agriculture and food production, as well as energy and medicine. You might hear people often complaining about GMOs or modified food products. Truth is, if we planted the same corn that they planted when Christopher Columbus landed here, we wouldn't have any food. So those are actually very beneficial improvements in the way that our food is being processed and grown. We've also seen biotech now expand to things like genomics, pharmacogenomics, proteomics, stem cell research, and nanotech. And we're going to touch on each of those very briefly. So, genomics is where we're seeing the study of all the genes in the human genome or the complete set of DNA, just like we talked about Watson and Crick with their study of DNA. It analyzes the structure and function of genes, what they express, how they're regulated, how they interact with the environment, ways they mutate, ways they change. And our research is going to be directed at basing treatments on an individual's genetic makeup. So each individual person is going to have a different genetic makeup, which would mean their treatment is going to be slightly different than the person right next to them. This is also going to help us identify inherited genetic conditions. So genomic testing uses specific tests to check for the presence of inherited disease or inherited genes that cause disease. This allows the doctor to start using preventative methods or early diagnosis to help eliminate or decrease effects of the disease. So currently we have tests in place that can test for possible genetic predisposition to breast cancer, ovarian cancer. I believe it was Angelina Jolie had a double mastectomy because she was predisposed to breast cancer and didn't want to risk having breast cancer later in life. We also have prenatal or pregnant screenings for cystic fibrosis, sickle cell anemia, and Tay-Sachs disease. And these just let you know if there is a genetic abnormality that your child might be predisposed to one of these diseases. Pharmacogenomics is when we're using a specific individual's genetic makeup to choose drugs and doses that are likely to work best for them. This helps us recognize that people respond differently to medicine according to their genetic makeup. I mean, it's 2022, so things have changed, but back when they first started doing drug trials, they were done on men. So there was not really a way of knowing if women would react differently to medications once they were FDA approved. So knowing if you're getting a medication that's specific to your gene makeup can show or lead to more accurate and more effective treatment, especially for things like cancer. Stem cell research is where we're studying stem cells, which are the cells that are capable of being any specialized cell in the body, so they can turn into just about anything. We have embryonic stem cells that come from a fetus, or somatic, which are adult stem cells. Research here is going to be looking at how these cells can continuously regenerate with a goal that we can use them to replace defective cells and then treat things like cancer, diabetes, and heart disease. Now, since they can regenerate into pretty much any specialized cell, this has brought about concerns about cloning. For instance, should we clone humans? Should we be able to choose a genetic makeup of a child? There's lots of interesting ethical considerations, especially when it comes to stem cell research. We're not going to get too big into ethics in this class, but I just want you to think about some of those things and how they could change in the future. That's it for Trends in Healthcare. If you have any questions, please let me know, and I'll see you next time.